Okay, well, we all know the story by now. You know, for the first 9 months or so of the COVID-19 crisis, we were on defense the whole time. And we've just been eager for good news as we've gone through this. And tragically, we've seen so many infections, now over 700 deaths in the Louisville area, approaching 400,000 for the country. And it's been tough. It's been tough on a lot of families. The pain that's been inflicted upon them and on our community is here. We got great news in December. With the arrival of the vaccines. The development of the vaccines was quick, it was efficient, it was fact-based, it was science-based. And as more and more people see other folks getting vaccines, they're realizing it's safe. And people are now saying, I want to get the vaccine as well. So we've been able to overcome quite a bit of the skepticism that some people had about vaccines as more and more people get the vaccine. So we're very grateful for that because we need 75–85% of the city to get vaccinated so we can have herd immunity. And that'll be obviously in the coming months, but we're moving toward that, so we're very gratified for that. It's appropriate. We're going on the offense right here in Broadbent Arena, where there's been some great basketball games in here back in the day. You know, last week was our first week. Our goal was 1,000. We did 2,000, and then we're doubling that again this week. We'll have about 4,000 people vaccinated coming through here this week. So it's been wonderful progress for that, and I'm incredibly proud of what's happening. We're really distinguishing ourselves amongst the cities of America and the states of America with what we're doing with getting these vaccines out as quickly as we possibly can. And I really want to salute our team at the Department of Public Health, Dr. Moyer, our leader. Thank you so much for doing this, and Dr. Sarah Beth Hartledge, who's leading the effort out here as well. These ladies are cool under fire. They like a challenge, and they're going to take us to even greater heights with our vaccine program as well. So we really appreciate that. Should note that Dr. Meyer has been on President-elect Biden's transition team with advice on how to administer the vaccine. And of course, last night, with President-elect Biden's announcement, you saw a major increase in focus on our ability to quickly get out the vaccine to more and more people all across America. So that's very exciting to see what those prospects could be in terms of getting America healthy, getting each one of us healthy, our families healthy, and of course that helps to reopen the economy very aggressively as well. So that's going to all have to work through Congress, but hopefully that'll be done in the early weeks of the Biden administration, so more help will be coming to the people of Louisville and the people of America as well. So, bottom line is, we got momentum, and it's always good to have Mo on your side. So, as we move forward with this, we're excited about people in Louisville getting healthy and getting back to work, doing all the things that we used to be able to just take for granted. So with that, I'll turn things over to Dr. Sarah Beth Hartledge. She's going to talk about the specifics of the work we've done here at Broadbent Arena.
I'm going to begin by announcing that our site here at LouVax gave its 5,000th dose yesterday, and we'll cross over the 6,000 total mark later today. That number is specific to this site, and our numbers across the metro area, including our hospital partners, are nearing 30,000 doses. As a reminder, our projected output by today was 3,000, so we're proud to say that we're continuing to exceed expectations, keeping pace with our state allocations and distributing at least 90% of our allocation on a weekly basis. As a community, our distribution of the vaccine has been orderly and efficient, and we're grateful to our healthcare partners from Norton Healthcare, U of L Health, and Baptist Health for joining with us in the fight to make our city safe from COVID. All of our local vaccine providers have been limiting their appointments to date to Tier 1A personnel, which are healthcare workers and medical first responders like EMTs and paramedics. Today, we're announcing that we're nearing the end of that stage, and as a community, we will begin transitioning to Tier 1B next week. Tier 1B includes some important groups, and I'm going to specifically address each of them now. The first is non-medical first responders, critical utility workers, and corrections personnel. They've already been contacted and are scheduled for appointments at the LouVax site next week. Likewise, we've been in communication with our local education leaders, and we're excited to announce that the first educators, the first teachers from our city will be vaccinated here at this site 1 week from today on January 22nd. The efforts to vaccinate educators will then continue for several weeks. Given the size of this group, it'll take us a while to get through them all. Finally, Tier 1B also includes adults over the age of 70, and our healthcare partners at the hospitals will be vaccinating the lion's share of this group. The first appointments will be available on Tuesday, January 19th, with signups beginning today. Beginning this morning, you can visit our website at louisvilleky.gov/COVID-19 and click on the big green vaccine button to sign up for an appointment. You will find links to directly schedule an appointment with Norton, Baptist, or U of L for adults over the age of 70. And if you've already signed up on our interest list, this information is also being emailed to you directly this morning. A couple of things to note about this process. All sites are operating by appointment only. There are no walk-in appointments. The number of appointments is limited and is based on the supply of vaccine that the metro area is receiving from the state. We anticipate the number of available appointments for 70-plus individuals being approximately 10,000 per week via this program, but we do know that there are over 100,000 people in this age group locally. There are over 30,000 of them on our interest list already. Please be patient. All sites will be dispensing vaccine as quickly as they receive it, and we will scale up this program as supply allows us to do so. If you cannot schedule an appointment right now due to availability, if everything is full, you can still join the interest list on our website, and we will communicate with you when more appointments become available. If you have questions, you can contact the Louisville Metro COVID hotline for assistance. When it's time for your appointment, please bring your confirmation with you to the site. There is no direct cost to you, but you should bring your insurance card, including Medicare. You may be asked for identification to verify your age on arrival. All sites, including this one and the hospitals, are operating by appointment only, and there are no walk-up appointments available. We're pleased to see how many members of our community are willing to roll up their sleeve and be vaccinated, and we thank you all for your continued patience as we move through this process as quickly as we can. I'm going to switch gears a little bit now and remind us that none of this is possible without the contribution of our amazing staff and volunteers. You see a lot of them behind me. We're staffing over 100 volunteers at this site every day. So I'm going to turn it over to Delanor Manson, Executive Director of the Kentucky Nurses Association, to talk about the people who make this program run. Thank you.
Good morning, everyone. We could not do this program without our volunteers. It takes about 180 people a day to make this site work. Last week, we talked about 140. At the rate that we're going, it's going to take 200 volunteers for next week if we're going to keep administering as many vaccines as we're administering. We've had over 3,000 volunteers to volunteer to help us provide the vaccines and to run this clinic. But we still need more. So if you have the opportunity, if you have the time, please help us and become a volunteer to help us get the vaccine out. So far, we've had 7,300 hours of volunteer time to make this clinic work. Our first volunteers that we would like to honor: Brittany Asher, Sarah Green, Lindsay Johnson, George Falk. George, thank you very much. And Jerry Hettinger. Hi, Jerry. I know that handshake, it's hard, isn't it? Thank you very much. We appreciate it.
So all of our staff and volunteers are amazing, and this is a very difficult choice. But I do have certificates for the volunteer and staff member of the week. So the volunteer of this week is George Simmons Falk, who helped us redesign our traffic plan in the back. And our staff member of the week is Miss Jenna Dixon, who is the volunteer coordinator at the health department. And I suspect when she took that job, she had no idea that I was going to ask her to wrangle 3,000 volunteers for a mass vaccination site. So thank you, Jenna, for keeping all of us in line. And I'm going to pass it back to the mayor now.
Well, again, a big thanks to all the volunteers. Great show of citizenship, and it's wonderful to see what Americans can do when we help each other. Okay, our next speaker is an invaluable partner to the city. Jcps has been through very, very challenging times over these last 10 months, trying to navigate themselves through this once-in-a-century pandemic through non-traditional instruction, remote learning, trying to make sure every family has got web access and a hardware so their kids can keep learning. So they have stuck in there and obviously have dedicated to helping our kids grow during this very tough time. So the news around teachers getting vaccines, last week we inoculated or vaccinated the first Jcps nurse. I mean, we're going on offense. Former basketball coach, likes playing offense here. Please welcome Marty Polio, Superintendent at Jcps.
All right, thank you, Mayor. And it is, we were here last Friday, and it's exciting to be here again today as we are getting closer. So I know we use this term a lot over the past month. We have a light at the end of the tunnel, but I think that light keeps getting brighter. So I'm pretty excited about the news. And at the end of December, Governor Beshear said that 1B would start the first week of February, give or take a week. And usually, you know, you hear some of the things like that. We were expecting, well, I guess that's going to have to be probably at the end of the first week in February. But we are pleasantly surprised, very happy to note that a week from Friday, even more than a week into January, we will begin our first employees getting vaccinated. And I just think that says so much about our local health department, what they have done here, our state health department, and everybody pitching in. You know, I'm often on calls with superintendents across America. And I've said this before, most large districts across America have been shut down and gone to virtual instruction for nearly the entire year, all the way back to last March. And most of them don't have information yet about when K through 12 personnel will be vaccinated so that we can move forward with in-person school. Except here in the state of Kentucky is one of the few. And they have valued K-12 education. And now we know next Friday, our first teachers, we did have employees last week, our school nurses, but our first non-medical personnel will be vaccinated. So I can't wait to be here next Friday so we can begin that process. Over that 2 weeks, we will begin going through all of our schools. Each one we'll have schools reserved. We will be starting with our elementary schools first. So we will be going by schools in alphabetical order, starting with elementary schools, then move to middle schools, and finally our high schools, so that we can get through all of our employees. And we will have a focus on opening up our primary grades and schools first. That's why we will start with elementary schools, but we look forward to having all of our employees that requested a vaccine, over 13,000, within this 2-week period. At that time, once we get through the first vaccination, we will continuously report this to our Board of Education, and then we can have a board meeting where we can make recommendations based upon that first vaccination and the booster to follow, when I can recommend and we can recommend to our board a reopening schedule. But we know this is a huge step forward for us in getting there, and we look forward to that. I'm so thankful that we can be on the offense and we can begin to look forward to opening our schools in person now sooner rather than later. Thank you very much.
Dr. Moore? Dr. Sarah Moyer, the Director of our Public Health and Wellness, is going to close out with a few remarks here. We missed anything, Doc?
Just want to remind everyone that this is very exciting, giving a lot of shots of hope here through this LouVax site. But we are still in a surge. We are the highest numbers we've had in Jefferson County. So please remember your 6 feet of spacing. Try to set a good example. Wear your mask. Keep activities to essential only. And if you are privileged to get vaccinated, it really is an honor to be at the front of the list. That does not mean that we could change our activities. Please keep doing everything that we need to do until our entire community is vaccinated, and then I hope we could have more good news to share. So thank you for that, and really excited about all the progress we've made and the 30,000 people that have been vaccinated in Jefferson County, and the more to come in weeks coming. So awesome. Thanks, Mayor.
All right. Okay, any questions?
I got one for you. Mayor, I'll ask you, sorry.
We'll come to you and then you.
Okay. I had a question just about moving into this next phase. With phase 1A being frontline healthcare workers, a lot of the people that are going to be receiving that are in a concentrated area where they know what's going on. But moving into 1B specifically, the 70 and up population, what sort of challenges do you expect with the rollout of this next phase? And this could be for Dr. Moyer or Dr. Hartley.
Dr. Hart. So what kind of challenges do we expect with 1B rollout, specifically as it relates to the over 70 population, both communicating, getting them here, and vaccinating?
I'm sorry to do this, but can you repeat your question? I can't hear across there. The
Challenges
challenges over 70, yeah. So one challenge is that a large portion of our scheduling, both by us and the hospitals, is being done online, although there are phone options available. It's also possible for you to sign up a loved one as long as you have the appropriate information with you. So if you have a parent or a loved one who needs help with that, you can help them get through the process. You'll need to have their birth date, insurance information, that sort of thing available to you. Transportation is an issue for some people, but we're working with partners across the community to help make that possible. And then the other issue with the group of 70 plus is just that there are so many of them, and they're very excited to receive the vaccine. It's difficult to know who's going to get to go first in that group and how long it'll take us to get through there because it's a large group.
Mark?
Well, the recommendation that I will make to our board, I want to reiterate once again, our board has the legal approval and the authority to make that determination. But yes, my recommendation is obviously based upon when we can go through the vaccination schedule, and moving that up at a full week and even a few more days, I think will aid us in having a schedule where I can make a recommendation sooner than what I thought if it was February 5th or 7th in there. So yes, that's correct. Well, it will depend on, once again, we will see which vaccination it is. One is 21 days, one is 28 days. We believe it's the Moderna, which is 28 days for the booster. And then 7 days following that is usually what we've looked towards to ensure the safety of everyone with the vaccination. So we don't have that specific date yet, but we know in a board meeting coming up soon, once we get through that first, we'll lay out what that recommendation will look like. I'm sorry, I can't hear you. What's my recommendation for them? Well, I think that's an individual decision for each and every person. I know I'll be getting the vaccine as soon as I can when I'm on the schedule and look forward to that. But I encourage everyone to. I think I would encourage everyone to. So I don't have any specific recommendation for a teacher who doesn't get the vaccine. No, there's no consequences for not having the vaccine. We will recognize the accommodations that need to be given based upon ADA guidelines. I'm leaving that to the experts, the lawyers, who will be going through those. We're contacting all those who ask for accommodations in the fall to see if they still need it based on the vaccine. So we'll be working with them individually, but there wouldn't be any consequences for not taking the vaccine. This what? I'm confident. I'll be making that recommendation. Obviously, the board will be voting on it. I think they want kids back in school as much as I do. There's a lot of things we've got to work through between now and then, but I'm confident that we will be back in school.
I just have a timeline question. How long is 1B expected to take, and when do you foresee 1C happening?
At the current rate of allocations, it'll take us probably at least 3 months to get through all of 1B. We hope that our allocations will increase, and we have the capacity to increase the speed if we have more vaccines to give. The teachers and other groups will be accomplished before then, but in terms of getting all the elderly through, probably 3 months is a reasonable timeline.
Would it be possible to see 1C starting in the spring, or do you expect that to be more summer?
It's possible that we could see 1C starting in the spring. There may be some overlap. It's difficult to say exactly. We're expecting some news on the federal level about what those allocations are going to look like. So these things are changing every day, and we're trying to keep up and keep pace with the guidelines. But we're probably looking at least 3 months for 1B, and then a transition, maybe a little crossover into 1C. Hopefully we get a larger allocation and we can go faster than that.
Let me just emphasize on that question too. I mean, President-elect Biden's announcement last night could really accelerate the amount of vaccines that are coming here. So I would really like for you all to put the emphasis on that so that the administration hears the public's demand for more. The Defense Production Act has not been called into place yet. That's a strong consideration that they're going to do, amongst many others, to really get this vaccine out quicker. So we're hoping that these are the most conservative estimates that we have. Well, right now, we're quickly passing the point where our ability to vaccinate is greater than the supply that we have coming in. Okay, so number one is increasing the supply, obviously. As I mentioned, invoking the Defense Production Act would allow that to happen sooner. Two would be allowing us to vaccinate at more locations. So this is a mass vaccination site here, but what you heard last night was the ability to stand up pharmacies, mobile vaccination centers. We'd like for people to go to many different places to be able to get vaccinated as well. So the funding to be able to do that. And then also you heard last night a tremendous greater commitment to public health and public health workers with the hiring of an additional 100,000 public health workers around the country to help with this as well. So there was a whole menu in there that could really help our country get through this pandemic, which is the key to reopening our economy. So I don't know if you all want to add anything else to that?
You got it.
Okay.
So our registration appointment spots are tied to the number of vaccines that we have available. So given that, we're filling all of our spots. I will say that both at this site and our hospital partners are experiencing a similar phenomenon. We're seeing a no-show rate between 5 and 10%. So I would like to emphasize that to the public, that if you are lucky enough to get in one of these early groups and have an appointment made, please show up, because if you're not going to come, someone else would love to have your spot. So, that's troubling. But if we have any difference between our allocation and the number we give in a day, it's mostly attributable to a no-show rate. So it depends on, they'll get an immediate confirmation if you fill out the form just saying that your data's been received. And we're doing that to encourage people to fill it out only one time, because we don't need 20 entries from the same person. But with that said, it depends on who it is and what their criteria are. So we'll be reaching out to people in groups based on their eligibility. So everyone on the list right now who's 70 plus will be receiving an email from us today. They should be going out right now. But if you got on the list and you're 45, that's totally okay, but it will be a while before someone tells you that you can schedule a vaccine. There are still some access for 1A groups through some of our hospital partners, but we're moving into 1B. So those special groups, first responders, corrections, and educators have already received outreach. Teachers will be getting their notification on their appointment times shortly, hopefully early next week. And then the 70 plus group is the largest group, and a lot of them will be going to the hospital systems. So the interest list, anybody who's on there now who meets those criteria will be hearing from us today.
How many people do you expect to come through this site from 1B? How big is that group?
Our first responder, critical utility, and corrections group is approximately 5,000 people. The educator population, including both Jcps, the Archdiocese, and a number of independent private schools, is approximately 3,000. So there's a little over 20,000 of them total. Jcps has just shy of 14,000 people that wanted to be vaccinated. So 20,000 of them, and then at least 100,000 of the 70 plus are out there in the community. Most of them will be going to the hospital sites.
In terms of who in the 70+ group gets to go first, is anything like consideration of pre-existing conditions taken into account?
So pre-existing conditions are listed in 1C, and that is irregardless of age. But for the 70 plus group, there's no separate entry for pre-existing conditions. We are using an equity lens to try and focus on zip codes that have been hit the hardest from COVID and areas of the city that we know are disadvantaged and struggle with healthcare access. And we've made that information available through our Center for Health Equity to our hospital partners so that they can help in getting access for those people in those areas. We're working with certain zip codes, and then also the Urban League is helping to get certain groups registered early as well.
I wanted to shift gears to another population. Yesterday the governor mentioned long-term care facilities. He'd like to see that process speed up a little bit, and that's where we're seeing a little bit more lag as far as percentage of vaccinations administered. So I wanted to see what we're seeing here at the county level in Louisville, and anything you guys are able to do or trying to kind of speed that process along.
The long-term care facilities are being vaccinated by retail pharmacy chains, CVS and Walgreens, and they have a completely separate process that they utilize internal to their own corporate processes. So we don't have really much control over the way that they act, and they also report their data differently, so it can be difficult to even know exactly how much of their allocation that they've concluded. With that said, we have representatives from both of those pharmacies and others on our vaccine task force, and we communicate with them regularly. So for example, when Walgreens had an overthaw situation where they had extra doses of Pfizer that were going to go bad, we were able to connect them with some groups to get those shots into arms of people from the right groups of people. So we're trying to help them wherever we can. But for the most part, their process is run at a centralized corporate level. So if the reasons we've seen where people cannot get a vaccine today, if you're currently ill, as in you have symptoms or a fever, if you tested positive for COVID within the last 14 days, and you should still be under isolation at your house and not running out anyway. And then the other major one is if you have had a different vaccine within the last 14 days. That's a specific CDC guideline. It includes flu shots and other vaccinations. It does not include tuberculosis tests, allergy shots, steroid shots, other types of injections. But any other vaccine, you need to schedule 14 days out. Our emphasis is on people who live and work in Jefferson County. There's some flexibility for folks who maybe live on one side of the river and work on the other, that sort of thing. Same thing for other counties, Oldham County, Bullitt County, that sort of thing. But our emphasis and our focus is primarily for people who do live in Jefferson County.